mental health professionals, integrating technology tools into your practice with Christine Moberg. My name is Astrid Masfar. I am the Senior Coordinator for Education and Outreach. Before we get started, I would like to go over a few items so you know how to participate in today's event. We've taken a screenshot of an example of the attendee interface. You should see something that looks like this on your computer desktop in the upper right corner. You have joined the presentation listening using your computer's speaker system by default. If you would prefer to join over the telephone, just select the telephone in the audio panel and the dial-in information will be displayed. Please mute your audio so we do not hear any background noise. To mute yourself, please click the mic icon, and please also disable your webcam by clicking on the webcam icon below the mic icon. You will have the opportunity to submit text questions to today's presenter by typing your questions into the chat box of the control panel. You may send in your questions at any time. We will collect these and address them during the Q&A sessions throughout the presentation, as well as the final Q&A at the end. There will also be poll questions throughout the presentation, so please be prepared to answer them. I would now like to introduce Christine Moberg. Christine is a licensed clinical psychologist and head of psychology at Pacifica Labs, Inc., a mental health technology startup dedicated to empowering individuals to manage their stress, anxiety, and depression. At Pacifica, Christina is responsible for designing and conducting research, writing grants, interfacing with forward-thinking healthcare providers and organizations, and designing digital tools that are based on best practices in mental health treatment. Christina's expertise in substance use disorder treatment provides her a valuable perspective on what motivates behavior change and helps her to build tools that individuals actually use. Christine completed her training at the University of Wisconsin-Madison, VA, Palo Alto Healthcare System, and Stanford University. Prior to working at Pacifica, she was a psychologist at the VA Palo Alto. I am now going to take a moment to pass the screen to our expert. There will be a brief pause while I do so.
All right, can everybody hear me and see my screen? Yes or no? All right, well, I'm gonna go ahead and get started. So I'm really glad to be here talking to you today, and thanks to ADAA for having this. I know you all are very busy, so I appreciate you taking the time to join us. I do have a couple polls, like Astrid mentioned. I find these webinars are more engaging when they're more of a discussion than a lecture, so please do participate. So the first thing was I just wanted to get a sense of what people are interested in implementing. It'll give me kind of an idea. So go ahead and Astrid's going to put up the poll there. Go ahead and respond. Okay, collecting responses. That's good. All right, so people are interested in learning about apps, secure messaging. Nobody's excited about the electronic medical record. That's not surprising. Okay, well, so let's go ahead and get going here. So let me see what's going on with my screen. Okay, great. So why hasn't this happened more yet? So consumers are increasingly demanding different treatment approaches. They really want to use the same technology that helps them call a taxi or manage other aspects of their lives to manage their mental health care. Well, clinicians tend to be more reluctant about adopting technology and changing what they're doing. And as mental health professionals, you all know behavioral change is hard. You've been doing things a certain way for a while, and it can really throw a wrench in it to just all of a sudden do things differently. And I actually read an article recently about sort of success or failure of implementations of mental health technologies and what contributes to the different outcomes. And as you can imagine, the barriers are things like the fit of the product to the disorder or the problem that's being treated, the attitudes of the people implementing the program, and the availability of support once it's implemented. So if the providers need technical support or more guidance on how to use the product, is that available? So that also matters as well. And speaking of sort of attitudes towards technology, this slide illustrates some of the questions that healthcare professionals tend to ask. Some worry about liability, they worry about cost. Sometimes they're skeptical that their patients or clients will actually use the tools. And they may feel uncomfortable with the product simply because they haven't been trained in how to use them or how to integrate them into their existing processes or workflows. And I'm not going to be able to address all of the questions that are listed on this slide. The main ones I'm going to cover are how to identify which products or tools to utilize, how to actually implement that technology once you've picked something. And then I also want to talk about some clinician-facing products and why they might be worth looking into. I do assume that by watching this webinar, you at least have some interest in taking advantage of what mental health technology has to offer. So I look forward to your questions and hopefully giving some answers. And I think even if you're not planning on implementing any of these solutions, you're aware that your clients are asking you for recommendations and you want to have some knowledge of this space so you can make an informed response to your clients. So this is just kind of my outline for today. I'm going to allow for questions in between each. I think that'll make it a little more interactive. So we'll go over the tools, some questions to ask, and then how to actually use the tools. And then finally, like I said, we'll talk about some clinician products. So as you're well aware, the number of digital mental health tools has grown tremendously over the last few years. And to some extent, this is a result of what we call the consumerization of healthcare. Basically, individuals are taking greater control of their health. They're trying to become more self-driven rather than relying entirely on doctors to tell them what to do. And this has some pros and cons, as you can imagine. I think it's also, the growth in tools is related to the increased capabilities of the smartphone. They're just able to do a lot more than they could 10 years ago. And I think also people are starting to recognize that mental health is really an important cornerstone of physical health, wellness, overall quality of life. I think there's a supply and demand issue in our field, and also people these days may be less willing to take an hour from their day every week to go to traditional psychotherapy. I think it's a good thing that consumerization is taking hold. I think people want to be more proactive and engaged. And what I have up on the screen here is an excerpt from a 2013 paper where Norcross and colleagues actually surveyed a number of mental health professionals to find out what they thought was the future of this field. Now, 2013 was already 5 years ago, but you can see that the online self-help tools, smartphone apps, self-help resources, all those things have actually really come true. This survey was pretty insightful. And what I want to talk about is how mental health professionals can really work with these tools and harness them to their advantage. I don't think clinicians are going to be replaced by machines, but I do think that clinicians who use technology and take advantage of what technology has to offer will continue to grow, and they may oust those who don't want to adapt to change. So this slide is sort of purposely overwhelming, and I put all these logos here because as you can see, and you probably know, there's a lot of digital health tools available, and it's a little confusing or overwhelming to find out which are on mobile devices, which are on the web, which are for consumers, which are for providers, what are for employer groups. And some of these logos will look more familiar than others, and that tends to be related to how they're marketed and whether they're marketed as consumer products or clinician products, whether they're a real clinical tool or more of a lifestyle or wellness product. And so when you're trying to sort through this, I've come up with a number of questions that I think can be really helpful to help determine what is the right product for you and your needs, and that can really help you narrow it down so that when you're comparing, it's not quite so much at once. So first, what is the cost? Or sorry, excuse me. Is it intended for self-help or for use with the clinician, or both? So some are designed as straight up self-help tools, while others are more of a practice extender. Some can be used in either setting, and you really want to identify what you're hoping to get out of the tool in order to decide on which you want to use. If you're looking for an app to recommend to your clients, you'll probably look more for standalone self-help tools. Those products tend to be geared toward less severely ill individuals, and they tend to be more wellness apps. They may rely more heavily on mindfulness or self-care, health tracking, things like that. Other times there are products that are designed really to facilitate the relationship between the client and the provider. And so you want to know is what you're looking for one or the other. If you're looking at practice extenders, you might want to consider tools that allow for teletherapy or assessment administration. And so really just that's one set of questions you can look at to try to narrow things down. The next thing I would consider is it a mobile app or a web app or both? So that relates to the platforms that it's used on. So some individuals really like to use mobile devices like phones or tablets. They like that they're portable. They feel like it can be more easily integrated into their daily lives. But some people would really prefer to sit down at a computer and set aside time. And in that case, they might want a web-based platform, something that runs on a desktop web browser. And really the main difference there, I think a lot of things that are designed for web browsers can also run on phones, but it might not be formatted right. It might not look as good. And so that's something to think about when you're thinking about your population. How do they want to use this? That might help you decide between something that's a mobile app, or something that's really a web-based product. So another important question is, what's the cost and who pays? So sometimes it's the end user, so they go into the app store just like any other app that you might get. They pay a few dollars, or they pay a monthly subscription. Other times they're free. Sometimes they're free to an extent. There might be a free trial. There might be limited features. And these are things you want to be aware of as you're recommending these products. Maybe it's something that the clinician pays for. If something is more of a practice extender, it might be something that you pay a monthly fee and then your clients get it for free. Sometimes there are, like if you're in a larger practice setting like a university, or you are an EAP group, there will be sort of an enterprise charge. So there's different ways that things can be paid for, and you want to just be cognizant of that. You don't want to send someone into the app store, suggest something, and then find out that it really needs to be done through a large group contract. The other thing to think about is sometimes flexible savings accounts or insurance can be billed or pay for these things, so that's worth looking into. Obviously, cost can be a barrier for people, so that's something to think about. And then I want to talk about privacy and terms of service and data handling. So this is something that you as a clinician are probably more worried about than your clients, although not always. But a lot of times when we sign up for new apps or websites, we skip right over those user agreements. We don't read them. We don't think about them. I think that's not always the best idea, especially when it comes to sensitive information like mental health data. There's just a higher level of kind of privacy that people want there. And I think if you're going to be recommending these products to your clients, you want to be at least somewhat familiar with the company's privacy policy in terms of service. It's been in the news a lot lately with people's information being sold, and so I think people tend to be a little more cautious than they were a few years ago, rightfully so. So I'm not an attorney, and this isn't legal advice, but the thing that I would really be looking for in a privacy policy is, what does the company do with data in terms of sharing with third parties, whether it's ever sold? A lot of companies have to use third parties for data storage, but that's not the same as selling to advertisers or creating user profiles. So that's just something to read, and it should be spelled out fairly clearly in a privacy policy. That is, it should be written for a layperson to read and understand, although it may be long. Next question would be, is there a coach? So some technology-enabled mental health products use coaches as adjunctive support. And these coaches' credentials do vary depending on the company. So really it's important to do your homework and learn as much as you can before you recommend something. The other thing I would think about as a clinician is, is that coach going to be doing something with your client that's consistent with what you're working on? Or could it be at odds with your approach, or maybe confusing to the client to have kind of more than one person working with them at a given point? On the flip side, if you're a psychiatrist and you're looking for something to recommend to clients, maybe you're just doing medication management and you're not seeing that client for months at a time, a coach could be a good choice. It could be helpful. So it really depends on your practice and what you're looking for there. There are also products that have peer support communities or one-on-one things as well, and these can be good tools, but again, it's important to keep in mind who your clients are, what their needs or preferences are, and really make sure that they're clear on what they're getting into and what's appropriate use of those communities. And then finally, what is HIPAA compliant? So is the product HIPAA compliant? That's very important. A lot of tech products actually don't have to be HIPAA compliant because they are not a covered entity. They're not providing healthcare. But if something is HIPAA compliant, that is going to demonstrate a higher level of security. And so any products that are connected to you as a provider need to be HIPAA compliant. You as a provider are a covered entity and you need to be compliant. So if you're using something where you might be sharing client data, and I'll get into this a little bit later when I talk about clinician products, but you do want to consider that when suggesting things to your clients. And again, anything that you use with the client directly does need to be HIPAA compliant. Okay, so are there any specific disorders treated or a specific therapeutic approach? So some products that exist today have sort of specific tracks or programs to treat certain disorders, where others are more transdiagnostic, they're more broadly applicable. I think either of these can be good. It really depends on what you're looking for. I do think it's important to educate yourself about the approach that the tool uses and consider how that sort of approach may or may not be consistent with your intervention that you're providing, and is that going to be confusing to the client, or will it work well together? And if there are two different approaches, maybe, how are you going to sort of spend some time with the client explaining how those two things work, or how they can work together? And maybe this goes without saying, but what features does the tool offer? Really spend some time with the product and understand what it has. Is it educational modules? And if so, how is that content presented? Is it videos, audio, reading? Think about if there are homework assignments. Really think about the features that are offered, and really thinking about what you hope to gain by using this product with your practice, and that will really help you kind of hone in on which ones are the ones that you want to work with. Again, this is a fairly obvious question, but it's a little harder to answer in the realm of industry than in academia. Is there evidence to support that the app or product is effective? So there are a number of reasons why it's a little bit harder in the realm of industry. Sometimes product websites will make claims that seem impossible, and I really suggest that you click on their statements and actually read the studies that have been done and try to get a sense of if they have in fact demonstrated that product works or not. Sometimes a product will be tested in one group and then sort of generalized and marketed to a number of groups, and I don't want to imply that all companies do this by any stretch, but I do think as a provider it's important for you to really look at the evidence and get a sense of what is there or is not there. So if it's a meditation app, you might be better served just sort of understanding how meditation is effective in the broad sort of intervention in the literature on that. Between one meditation app and another, they're going to be pretty similar, other than the sort of aesthetic or the design of the app. So in that case, you might just want to know, oh, does meditation work for this condition? Whereas in other products, there might be a more specific intervention. In the absence of any published literature, you can also look at App Store reviews. And obviously this isn't scientific, but it gives you a sense of the usability of the app, whether it's something people will enjoy, whether they'll stick with it, if it's something that is engaging. And then I also noted resource guides here. So there are a lot of guides out there, not a lot, there's a few on mental health apps, and they can really be helpful for getting general information, familiarizing yourself with the marketplace. One thing to keep in mind is that just to look at the dates on some of those. So as you can imagine, they can't constantly be re-reviewing products. So technology moves pretty quickly, and when things change, the resource guides aren't always completely up to date. So you want to just be cognizant of that, but they can be very helpful for sort of a starting point for looking at which products you want to consider to work with. So I'm going to pause here and see if anyone has questions regarding sorting through the marketplace, or how you can kind of judge different tools that are out there. Just give a minute here. So one question is, people come to apps with the idea that the app will cure them. How do you encourage them to seek help and use the app as a support tool instead of their primary method of treatment? That's a good question. I think sometimes the apps really need to make that clear themselves. They need to have disclaimers where it's, this is not a substitute for professional treatment. I think that's also sort of a public understanding where, we as a society need to have a dialogue about what an app can and can't do. I do think there is a world where there are apps that actually do connect people to providers, and in that case, it could be considered more of a cure. So if someone is, so I don't want to name names here, I'm really going to try to avoid that as much as possible, but there are products where, the app is actually like a facilitation between a user and an existing therapist. And in that case, it could be seen as a cure. So I think, if you're talking, obviously, if someone's in session with you, they're okay with getting treatment. But I think otherwise, it's really just sort of a public education thing and people understanding kind of the limits of these apps versus, that they're not professional help. We try to put in our product in a number of places. This is not an emergency resource. This is not a substitute for help. We provide a link between our users and professionals to highlight that. But I think broadly speaking, it's hard for the apps to do that because once someone has come to them, they might already have that belief. So it's more of a proactive education that needs to happen. Any other questions? Okay, well, I'll move on and then you can also ask at the end as well. Okay, so we're going to switch gears and I want to talk about how to actually implement the technology and sort of effectively integrate it into your clinical practice. So this seems obvious, but if you're recommending an app, a really important first step is to become familiar with it. Use it yourself, spend some time exploring it, see what the experience is like for a user. What tools does it have? How are the tools introduced? How are they explained? And what are the limitations? So I think you really don't want to undermine your client's confidence by suggesting that they use a product and then when they ask you a question saying, well, I don't really know if it does that or not. You wouldn't do a therapeutic intervention that you didn't have a deep understanding of, and this is kind of similar. You do want to really know what you're recommending. What this means, I think, functionally, is that you really want to pick a few apps, very few, and stick with those. It can be very challenging to familiarize yourself with a number of products, and you could be confused, and the clients could be confused. So really pick one or two and stick with those, and become very comfortable with them. I think the other thing is considering the client factors. Really, some are more or less comfortable using technology. They see value or they want to do it. Others are very firmly against it. They don't see what it has to offer. So just don't try to push people that are very cold about it onto it. Just like any other thing, what they're willing to do is what's going to be most effective. So they're the people that are middle of the road, you might be able to encourage and use your judgment there to just one of the sort of non-specific factors that's really important in treatment is your ability to convey the value of the treatment, the efficacy, and that is important. So that's something to keep in mind with those middle of the road people. But if it's clear that someone's not interested, don't try to push it, and that probably goes without saying. The next is sort of helping the client to begin using the app or the platform. Some will want you to walk them through it, while others would really rather do it themselves. I think ideally you're not sitting in the therapy room, grabbing their phone and punching in their name and password, but really just gently helping out where needed, giving them a little more confidence. I think if you download, install, sign up, do all that for them, they're not going to feel very confident with it when they go home. They're not going to know what to do. So, it might be the case where you introduce it sort of toward the end of a session, make sure they kind of have an understanding. But really, you don't want to drive that too much because then when they get home, they're not going to really know what they're doing or not feel comfortable. I think it's also really important to talk about sort of confidentiality and appropriate use. So the main concern that most clinicians have is sort of communication of thoughts of self-harm. To my mind, much like any intervention that you would provide a client, you really want to start with informed consent. Talk about what you'll be doing, talk about what they'll be doing, explain what the app can or can't do, how they should use it. If it's a tool that has some built-in communication, whether that's secure messaging or an assessment that you're going to review, really talk about what you will or won't use that for. Tell your client that this is not for communicating emergency information and so forth. Making sure that they understand you may not see that message right away, that you're not going to immediately review it. You do want to be on the same page with your clients, and given that, it's really worth knowing that some populations are more or less appropriate for using these technologies, and that's your role as a clinician to use your judgment and decide how to proceed. The next thing is how to make that implementation most helpful. So think about, what do you want the client to get from that app or product? Maybe you simply want to facilitate their meditation practice and think, they might be more successful if they're using an app rather than just searching YouTube or sitting meditating themselves. Maybe you want to use an app with CBT. I think Pacific as an example here. So maybe the person isn't interested in a paper and pencil, but using an app, they might be more willing. That in that case, the app would be helpful. But I think in both cases, you really want to be specific with your client. Just like we know from goal setting in treatment, you want to be specific, use measurable, attainable, reasonable, time-limited goals. So don't just say, hey, go use the app this week, but you want to specifically say, please do this thought record on Wednesday, and we can troubleshoot why that may or may not happen. And really, the more specific you get with the client, the more likely they are to actually follow through, rather than just saying, oh, there's some apps for that, you might want to try them. They're probably not going to do that, and it's not going to be particularly helpful. So the more sort of specific and granular you can be, the more likely they are to actually follow through on those things. So another pause here. Any questions about implementation and kind of how do you actually include those apps as part of your in-person treatment? Okay, so question, many of the apps have not been demonstrated to be effective. Can you list any that have? Or use primarily techniques that have been demonstrated? The apps are competition. They compete with clinicians for dollars and time. I think it's somewhat true that the apps do compete with clinicians. I think, one point that you might be missing is that sometimes people don't realize that they have a problem, and I think there are people who truly don't realize that they are struggling with depression or anxiety and actually using something that helps them track their mood and see that, oh, something is not going well here. It actually can facilitate their kind of understanding of their mental health state and really allow them to see, hey, I should actually seek treatment. And so, if you think about sort of a funnel, broad at the top and narrow at the bottom, there are people that are just simply unaware and they never get to the clinician. So 2/3 of people who actually need help don't get treatment. So yes, I think these tools may be competing, but at the same time, there's a real supply and demand problem. It's not that clinicians can't find clients, it's that clients can't get the help that they need for, cost, stigma, access, time. I mean, I think there are probably more people that need help than clinicians that need clients. In terms of apps that have been demonstrated to be effective, I don't want to speak to that simply because I am not familiar with every single company's research. There are, sort of proprietary reasons for that. What I would suggest is you go to their websites. You can reach out directly to the companies and say, have you done these studies? What have you found? What tools do you implement? So if they do meditation, you probably are familiar with the literature on meditation, whether it works for this or that condition. I think there are tools so I can speak to Pacifica. We use CBT and mindfulness meditation. We have thought records, we have goal setting. So those things have been shown to work. The next big question is, do those tools work in this format? So outside of a 15-minute session with a therapist. And I can just say that we're, building that evidence. It's not published yet, but I think, I can't speak to the other apps just for, their other companies, but the data is out there. If you do, I would say probably narrow down the marketplace to a few that you're curious about, and then you can contact them directly or spend a decent amount of time on their website. You should be able to find either data or an absence of data, and that can tell you. Another question. So clients who aren't comfortable with technology but are looking for mindfulness or self-care, what resources? So for people who don't want to use technology, that's tough. I think sometimes if they really want to start a mindfulness practice, they could look at yoga studios. Sometimes will have classes that are sort of less movement focused and more mindful focused maybe. I've worked in clinics where they have ongoing mindfulness-based stress reduction or mindfulness-based cognitive therapy groups. I think there's Sharon Salzberg has a book that's really great that comes with the CD. I think there's a few other books out there if they're really not interested in technology. I guess going on YouTube is still using technology, but there's tons and tons of guided meditation, both audio tracks and they typically will have like a soothing photo in the background and play music. So that's another thing. But if they're really averse to technology, I think they have to look in their community and see what resources are available. There may be a community center or, where I live, there are a couple of they have like a church model where they'll have a meditation group weekly that you can kind of pay some small fee and kind of be a part of that community and do that. Yeah, let's do one more question. These are good. Okay, so I treat OCD and phobias. Does Pacifica have anything for exposure and response prevention? Yes and no. So we do have a goals tool where clients can build their hierarchy. So what you would need to do as the clinician and or assign to the client as homework is to build their hierarchy. So we have a lot of we have a lot of preset goals. So our co-founder struggles with social anxiety, and so a lot of the goals tend to be social focused, but you can actually put in custom things. So if you and a client want to sit and build a hierarchy for exposure, you could certainly do that. In terms of the response prevention piece, that would be a little harder, and you might need to do that in person. And then I will say that we're working on sort of revamping that tool so that clients we have a sort of pre and post distress rating. We're going to hopefully revamp that soon to where they can actually rate their SUDS level during the exposure, but that's not available yet. Okay, so I'm going to move on to clinician tools. So most people in private practice have a website, but that's a very basic first step towards getting your name out there, getting awareness of your practice, finding clients. But I really think it's just kind of the tip of the iceberg. There's also therapist directory, so everyone knows about Psychology Today. I'm pretty sure that's the biggest one. There's also professional organizations like ADAA, ABCT, APA. There's also a lot of smaller, newer therapist directories. Personally, I think it's until they reach sort of a critical mass, it's hard to know whether those are worth paying for. But you can talk to your colleagues and see if they've had any luck getting clients from there. And I really think, a website and a directory is sort of the first step. I think more interesting are sort of psychoeducation tools. So some of this you're going to do in session, but what about having tools that the client can refer back to, they can practice? So instead of, hey, please go buy this book on Amazon for $25, or here's a handout that I've photocopied for the last 10 years, directing them to something that's a little more engaging, more convenient. They'll always have it with them. That's something that technology can provide. I think the other is homework, both the ability to complete it and then also to send reminders. So I think this can really help with between session carryover, is to say, hey, I want you to do this exposure or this behavioral activation thing on this day. We talked about when would be a good time, when it fits in your schedule. We kind of did some troubleshooting, and really then you could send them that reminder, and I think that could make the therapy more fruitful and really kind of move things forward. And then lastly, I think technology tools can be really helpful to implement measurement-based care. If you're not familiar, measurement-based care is the routine use of clinical assessments like symptom rating scales to track progress, make treatment decisions, adjustments to treatment. Measurement-based care has been touted by groups like the Kennedy Forum, experts like Michael Lambert, Scott Miller. The fact is that we really aren't as aware of client deterioration or progress as we think. Clients aren't always forthcoming. They don't always have the best memory. And the research shows that really regularly using these measures can actually improve quality of care significantly. So that's another place where you can do it the old-fashioned way with paper and pencil and spreadsheets, but technology can actually make this much easier to implement. And then, as I said, yes, this can also improve treatment. The other thing is you can be reimbursed for this. So there's the CPT code 96127, which is designated for administration, scoring, and documentation of brief behavioral emotional screening. And some examples would be the PHQ-9, GAD-7. The Medicare reimbursement allows for $6 per screener, up to 4 per patient per visit. Now, really, obviously, you want to check with your insurance company any panels that you're on. But some of the major ones do reimburse for this. So Aetna, Cigna, Medicare, United Healthcare, some others. So the combination of knowing that this improves outcomes and that you can be reimbursed for it, to me, it seems like totally worth doing. If you're not sure if you'll get reimbursed for it, you can also just, try to submit one claim and kind of see what happens. So another poll here, I'm curious, teletherapy gets a lot of attention, so I want to know, have you used teletherapy? So I think Astrid will go ahead and submit that poll. All right, let's see. Oh, pretty good split right down the middle there. Okay. Now, can you see my screen? Okay, cool. I think we're back to me now. Okay, so teletherapy. Oh, there we go. Teletherapy. All right, so teletherapy can be a really great way to expand your practice. See clients who are typically underserved. It could be they live in rural areas, they may have limited mobility due to physical conditions, transportation problems, can reduce no-shows or cancellations. And studies have really found that it's very similar to in-person treatment in terms of client satisfaction and efficacy. Some caveats here, though. First, so many states have actually mandated parity with in-person treatment, but it still is sort of mixed as to whether insurance will reimburse. So personally, I was on an insurance panel. I asked, could I do teletherapy? And I was told, we reimburse for phone sessions. I said, okay, what about teletherapy? And they just said, literally, there was no answer. So it's a little bit mixed. I think, it's worth calling them, trying to get that figured out. I think if you can't get a straight answer, the other thing you could do is just try to submit a claim. If you're willing to risk not getting paid for that one session, you could see what happens if you do one. So many of the parity laws are determined on a state-by-state basis, so you want to check with your state. And the American Telemedicine Association has a lot of information on their website, so that's a good resource. The other thing I want to mention is about the state issue is that if you're trying to provide therapy over state lines, do your homework. You got to look at the laws of both your state of licensure where you live, but then also where your client is. So it may very well not be legal to provide therapy across state lines. And I think this will be changing in the future. I know the APA Practice Organization is working on this to get sort of reciprocity between states, especially in states that are rural with very few providers. But we're not quite there yet, so you really want to look into the laws. The other thing is HIPAA compliance. So it is required that you use a HIPAA compliant provider for telehealth visits. So Skype, FaceTime, you're breaking the law. HIPAA privacy and security requirements for telehealth visits are the same as in-person treatment. And the other thing to think about is your professional liability insurance. So you want to just check your policy and see if that would cover you for telehealth visits as well as in person. So I think, yes, there are some caveats here. If you're seeing clients in your state, especially if they're paying cash, if you're using a HIPAA compliant server, not that hard. It gets more complex as you're working with some of those other factors. So here I just have some logos. So like I said, FaceTime, Skype, Google Hangouts, they're not HIPAA compliant. If you are working with someone who says they're HIPAA compliant, you need a business associates agreement, and I can go into a little more detail about that. Same thing for secure messaging and encrypted email. So a lot of times providers want to communicate with their clients. They know they need to be using HIPAA tools. Text messaging can be convenient. There's no audit trail. So one of the things that you need for HIPAA compliance is to have an audit trail. I will say putting in a thing in your signature line that says, you know, email is not secure, please don't communicate sensitive information, you know, that doesn't often dissuade clients. Sometimes they'll just put something right in an email. And just because your client's not comfortable with it, that doesn't actually make it okay. If you're going to be using email, you really do need to be using HIPAA compliant email. Clients have to consent to any electronic communications, and this should really be spelled out in your notice of privacy practices that you give when you start treatment. There are companies that provide secure messaging or texting or phone. If you're using Gmail, you can actually sign a business associates agreement with Google, and then their G Suite is HIPAA compliant. That doesn't mean you can just go use Gmail the way that you have been, but you really do need to have that BAA on file with Google. And I think there's a small fee, but it's not a lot to do that. The other thing is sometimes people sign up for encrypted email services. The couple that I've heard of are Hushmail or Proton Mail. Those are encrypted as well. And then ethical or legal questions. So I spoke a little bit about this earlier. I just want to come back to it because this is such a big concern for most providers. I really believe in taking an informed consent approach. You know, you want to be clear with your patients that you may not see messages from them immediately. You want to talk about what the tools can or can't be used for. You know, if it's a psychoeducational tool, you want to make it clear this is not a way to communicate suicidal ideation, and make sure they understand the limits of technology. And they may be pretty tech savvy, but you just want to make sure that you're on the same page about what the tool is or is not for. And again, it's being cognizant of your population, depending on their age, their diagnosis, symptom severity. You know, that'll really speak to whether the tool is or is not appropriate for them. And that's all I have there. So any other questions, please send them, and we do have plenty of time. I treat depression using behavioral activation. Does Pacifica incorporate this? So yes and no. Unfortunately, we do have the goals tool, and like I said, regarding OCD, you can create a custom activity. So it could be like, we do have a number in there that are, you know, go to school, go to work, take care of this or that. More of them are coming, but you can always put in custom ones. So if you and a client have discussed specific behavioral activation activities, you can put them in. And then if you're working, if you're using the clinician product, you can actually schedule those reminders. So you could say, you know, on Thursdays at 4, you're going to go do XYZ thing, and then they'll get a reminder that they should do it. So we don't have all of the what we call pre-baked activities aren't in there yet. I've written them, but they're not actually in yet. But you can certainly do custom behavioral activation activities. Okay, question 2. I like Wobot. It sort of satisfies the Turing test. Seems like a human being. Can you comment on how Pacifica compares? So I've used Wobot only a little bit. I found it actually a little bit frustrating because I would tell it, you know, I want to know what this is going to cost after the trial period, and it wouldn't respond. And from when I read the article that came out about it, basically they have built the ability to kind of, if you imagine a tree, sort of a decision tree, they've built the ability for someone to move around to different places, but the implementation isn't there yet. So you basically are on a set track, even though it gives the impression of choice. So that's a difference. The thing that's nice about Wobot is that it exists in Facebook Messenger, which now that I say that, I think they might be coming out with their own standalone app, or they did. But when I was using it, it was in Facebook Messenger, which is a little bit challenging because you then have to think about all the information that Facebook has as another company. So they, you know, what's nice, I guess, is the interface of it kind of seems like you're talking to someone. Like I said, I found it a little bit unwilling to change tax when I asked it specific questions. The way Pacifica makes its activity suggestions is we ask for a mood rating, and then I've written an algorithm. Basically, when someone starts using the app through the onboarding process, we say, what are you hoping to work on? And so based on their goals and their current mood rating, we make suggestions. Oh, you might want to go take a walk or do this meditation or try this thought record. And so that, I mean, I know because it's our product that it is responsive to their inputs. And I felt like Woebot was a little bit less. I do think it will get, the nice thing about technology is that it iterates very rapidly. So I think all of these tools are going to get better and better very quickly. Okay, so another question. I'm trying to pick an EMR. Any advice what to look for? I think it depends on what you're trying to do. So if you work with insurance panels, it would be nice to have something that allows you to submit those claims electronically. Depending on how you're taking payments, having some billing would be nice. For me, I guess it depends on your client load. How many notes are you taking? Do you feel like note taking is a big burden? And if so, it might be helpful to use one that has a lot of templates that allows you to kind of move more quickly through the note writing process. Save you some time there. What else? I've heard good things about Simple Practice, Practice Fusion, Therapy Notes, Theranos. I mean, there are so many. There's a couple websites that compare them. I think, what was the one? Oh, I can't remember now. But if you search for, mental health practice management software compared, you can find a few websites that will kind of break down the differences. And I think one thing to keep in mind when you're looking at those is some of them will have sponsored, like, the companies will pay to have their listing improved or this or that, have a featured review, but you can kind of dig in and read the comments that actual users have provided, and that can be helpful. So that would be what I would do. But I do think whether you look at, billing or insurance stuff depends on your practice. Okay, so next question. Okay, so looking at CBT for insomnia, we want to know about sort of paper sleep logs. People are looking for a CBTI app that really allows them to save time on those sleep logs. So, and they're asking, is this something we could do? Yes and no. We could theoretically do it. We looked into building a insomnia track, and it's, we're a very small team. It's a lot of work. In the meantime, I would take a look at Sleepio. The company's called Big Health. Their Sleepio product is really cool. The downside is it's very expensive for individuals, but there may be, the VA might have I think the VA has a companion app for people who are doing CBTI that's free. Sleepio, like I said, is really cool. It's like a whole wraparound product, but it's, I think, like $300. So unless someone gets that from their employer or insurance company, that's a pretty high barrier to entry there. For us, yes, it's definitely something we could look into, and I can put it on the list for things that people want. Okay, question for secure text messaging. So we have, in our dashboard, we have a way that you can do secure messaging. If you want something that's a little more standalone, you can look at Spruce. I haven't used it, so I can't endorse it, and I certainly haven't compared it to other products, but that's the one I've heard of, is called Spruce. And then post-session assessment. So I'm assuming by that you mean, how do you feel like the session went? Do you think that we were on the same page about treatment goals? What's his name? Scott, I think it's Scott Miller, has the OQ system of assessments. Those look really nice. We built our own. It's obviously not validated, but it's sort of similarly, assesses, did you feel like we agreed on goals? Did you think this was helpful? So the OQ, that, they do have a fee. I don't think it's particularly high. Trying to think if there's any others. You could always make your own, honestly, if you're not ready to make the leap to using technology for assessments. You can always kind of just make your own and have it on paper. But I do think that's really helpful. And, there are things that, we're working with people who tend to be maybe less confrontational, obviously, depending on your population. So they may really feel more comfortable disclosing, not a therapeutic rupture, but sort of a, we're not exactly on the same page. They might be more comfortable putting that on an assessment than really telling you in session. Any thoughts on voice over IP versus regular? I think, again, and then any suggestions, I think Spruce also does secure phone. To be honest, I don't have a good answer to this. I haven't looked into it. I didn't really think that this was something you had to consider. It might be that if you use voice over IP, you have to be HIPAA compliant, whereas if you use a traditional phone, you don't. But to be honest, this is not something I'm that familiar with. But I would look at Spruce probably. I think they might have that as well. And I think one thing they allow is that you can use your personal cell phone for a therapy phone number. So for example, you wouldn't have to maintain 2 phones. You could just have the calls forwarded to your personal cell phone without giving your clients your personal number. So I would look at Spruce for that, but I'm not as familiar with the HIPAA laws surrounding phones. One thing I didn't really touch on was sort of children and kind of, can you use these tools with kids? So we do have a law in the US called COPA, which is sort of the Children's Online Privacy Protection Act. Kind of like HIPAA, it's pretty non-trivial to comply with. So while some of these tools may be okay to use with kids, if the company does not comply with COPA, I personally wouldn't want to be recommending it, simply because of the possibility that something could be non-compliant there. So that's under 13. So if you're working with teenagers, it would probably be okay. Any other questions that folks have? Anything about HIPAA or BAAs? I know those were things I wasn't particularly familiar with until I started in this industry. Okay.
Thank you, Christine, and thank you to our participants for attending today's training. In about 1 hour, you will receive an email that includes an evaluation of today's presentation, and we would appreciate if you would complete that and provide your feedback. The email will also include a link to view the recording of the webinar. We invite you to save the date for ADAA's annual conference on March 28th to March 31st in Chicago next year. On behalf of ADAA and our presenter, thank you for joining us today and have a great rest of your day.